am Dr.GarimaAsati. Welcome you all in my YouTube channel. Friends, today I am going to explain you about the topic PCOD, that is Polycystic Ovarian Disease, in this video in English on the demand of few of my non-Hindi patients. So let's talk about PCOD. So at first I am going to tell you the difference between the PCOD and PCOS. So PCOD is a disease which involves only one organ, that is ovary, while PCOS, that is Polycystic Ovarian Syndrome, is a collection of symptoms which involves the whole body. Now, what is polycystic? So it is multiple cyst, and cyst is a blister filled with fluid. But here in PCOD or PCOS, there are immature follicles present within the ovary which are termed as cysts, and as they are multiple in number, that's why it is termed as Polycystic Ovarian Syndrome or disease. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel, tap the bell icon to get the latest updates of the videos, and kindly see the video till the last, as in the list I am going to tell you about some of the homeopathic medicines which can be helpful in curing this PCOD or PCOS. Now let's talk about the sign and symptoms of this PCOD or PCOS. So irregular menses or menses irregularity, it can be seen as oligomenorrhea, that is menses remains for a day only. Or amenorrhea, that is complete absence of menses for 3 months or 6 months or even more. Infertility can also be seen, that female can't conceive because of anovulation. And hyperandrogenism, that is increased male hormone which can lead to hirsutism, that is increased hair growth on chin and chest. And along with that, there may be obesity because of this PCOD or PCOS. Lower abdominal pain can also occur, and there may be patches occur like thick, dark and velvety patches on the skin. Now, what is the triad of this PCOS? That is irregular menses or amenorrhea. Second one is hirsutism. And the third one is obesity. So if these three symptoms are present in a female, then it is a confirmed diagnosis of this PCOD. Now let's talk about the causes of this PCOD. So there is genetic or familial history of this, as well as there is lack of exercise. Now let's talk about the diagnosis of this PCOD. So pelvic ultrasound can be helpful. Along with that, blood serum level can be checked for increased AMH, that is anti-Müllerian hormone, increased FSH and LH ratio, and increased androgen hormone, that is male hormone. It gets increased in blood level. Now let's talk about its homeopathic cause. One of my cured case of PCOD via homeopathy, and some of the homeopathic medicines which can be helpful in curing this PCOD. So its homeopathic cause is females want to become like males. I want to achieve, they have a feeling like that. And I want to be equivalent to males. So the male hormone, that is androgen, it gets raised within the body and causes this cyst formation inside the ovary. A female patient approximately age of 23 years suffering from this PCOS, having oligomenorrhea, that is only for a day, menses remains only for a day, and the cycle was of 40 days in spite of 28 days. So 2 irregular menses, and along with that the physical generals were she was thirstless, changeable thermals, and in mental general she was very mild, weeping, can't narrate her complaints without weeping, forsaken feeling, and she feels that nobody cares for her, nobody loves her, she is alone in the world, and she feels pleasure while doing suicide. So she wants to die by drowning. And along with this, she was very mild, gentle and timid, extrovert, wants to make friends only because she feels she is alone in the world. So the rubric taken was delusion, she is alone in the world. And the medicine given was Pulsatilla 200, which cured her completely within a period of 1 year. And she got completely cured. And why this takes 1 year? Because it is a complaint of approximately 4 to 5 years. So it takes time of 1 year to get completely cured. Now let's discuss about some of the homeopathic medicines which can be helpful in curing this PCOS. So the first medicine is sepia. There is bearing down pain along with dysmenorrhea, that is pain along with menses, too late and scanty menses and scanty periods. It may be oligomenorrhea or it may be amenorrhea too. There is dryness of vagina and vulva. Along with that, there is relaxed pelvic organs and there is leukorrhea of yellowish thick discharge. The mental generals of this sepia is indifferent to loved ones and wants to do occupation only, wants to be busy. Occupation ameliorates her, even she gets tired from it and becomes irritating too. She has a choice what to do. So she leaves the family for her job, for her occupation. So she is indifferent to loved ones and she wants to do business because she doesn't get care from anyone. And music, that loud noise, aggravates her and she's sensitive for her. So these symptoms corresponds if it could be sepia, and sepia could be helpful in curing such PCOS. The next medicine is lilium tick. So in this there are early menses but scanty bleeding and very dark and clotted and offensive bleeding. There may be amenorrhea too, and the period of menses aggravates her complaint. Flow only when moving about. Now the mental generals of this lilium tick is she is very dissatisfied with own or dissatisfied with herself. And she wants to do everything very fast, in hurry. She wants to do several work at a single time and there is constant inclination to weep. She is weeping like Pulsatilla too and having tormented feeling that everyone surrounds me, torment me. So this is the feeling of lilium tick. If these symptoms correspond, then lilium tick can be helpful in curing such patients of PCOD. That's all about this topic. We'll continue with something else in the next video. It's my humble request to you all, kindly don't take any medicine without consulting doctor. So consult the doctor before taking any medicine. The clinic address of mine and the contact number is given in the description link. So stay connected to stay healthy. Thanks for watching.